morning. This is Dr. Julie Hollberg, and it's a pleasure to be presenting with Shannon Caul and Elizabeth Sprouse. We are very passionate about patient portals and improving our portal at Emory to create a better patient experience, and look forward to sharing our approach with you today. Next slide. So we had two real objectives. We wanted to show you how we've developed a scorecard and how we use that to score patient portal based on the likeliness of patient engagement. And then we wanted to also show you how we've used our scorecard to help inform our improvement initiative. Next slide. Just to give you a little bit of background about Emory Healthcare, we're a large health system in the Southeast. We have 11 hospitals with almost 2,700 beds. We also have a very large outpatient footprint. We provide comprehensive outpatient care throughout Georgia and had 4.7 million outpatient service visits last year. We've got 2,800 Emory employed and private practice physicians that work in our hospitals and in our clinics, and they practice across 70 specialties. In addition to that, we have 23,000 staff, so we're a large organization. I also wanted to give you a little bit of background about our patient portal team, just so you could benchmark what are the resources that we have at our disposal to help improve patient portal, and also give you a little bit of info about our patient portal statistics. So we look at enrollment, and we have almost 475,000 unique patients that are enrolled in our portal. But beyond looking at enrollment, we also really focus a lot on utilization. And so we look at how many unique users we have that are logging in and active on our portal every month. And we average, in FY19, we average 93,300 unique users per month. We acquired 3 new hospitals and a new provider medical group in June, and anytime we have a big influx of new patients, it really increases our enrollment as well as our calls. We, a few years ago, were able to successfully negotiate for a centralized patient portal support team, and that team consists of 2 full-time call center agents, and we take around 1,500 calls per month spread amongst those 2 agents, and they're answering calls related to enrollment as well as when patients have challenges, sometimes navigating the healthcare system or navigating the patient portal. We have a full-time portal project manager that we were able to secure as part of a philanthropic program, and that project manager focuses exclusively on patient portal initiatives and reporting. We're very data-driven at Emory and focus a lot on measurement, and so we have lots of reporting we have developed and help to disseminate to our clinicians in different specialties. And then lastly, the patient portal team rolls up to 1 full-time manager, and she spends 20% of her time dedicated to the portal, and that's Shannon Caul, who you'll also hear from today. Next slide. So it's my pleasure now to turn it over to Elizabeth Sprouse, founder of Double Lantern Informatics, who really did the work in developing the scorecard.
Hi, everybody. I'm so excited to be here with you today and share some of this information. So for the next few minutes, I'm going to talk about the development of the scorecard, and then we'll go into the case study with Shannon and Dr. Hollberg on how they've applied the scorecard within the Emory Healthcare organization. So the purpose of developing this scorecard was to develop a way that healthcare organizations can evaluate their patient portals based on likelihood of use. So not does it improve patient outcomes or patient engagement or activation, but, goodness gracious, are patients going to be able to sign up and log into the portal, and then will the magical things that they want to be available in the future be waiting for them once they log in? And a lot of this came out of the fact that although patient portals are becoming, really standard in healthcare, we don't have a very good way of measuring scorecards and if it's giving patients access to, to log into their healthcare information. And healthcare systems have a lot of competing priorities. There's only so much money to go around. So when you are looking at your long-term roadmap for a patient portal, you need to put your efforts that are, where you can move the dial on making sure that you're engaging patients electronically through a patient portal. So to conduct this study, two things happened. I won't dig into all of the kind of the academic rigor of this particular study, but it was fairly simple. There were two components: an academic literature review, as well as qualitative phone interviews with healthcare executives across the United States. So those phone interviews were really the linchpin in developing the scorecard, because although there's a lot of great literature out there, there's not a ton that's published around patient portals, and a lot of times the people who are down, the boots on the ground doing the work, that have that information that can help inform change, don't have time to publish. So that's where those phone interviews came from. From the academic literature review and the phone interviews, I did basically a frequency distribution of how many times things were mentioned as being linked to likelihood of increased of patients using the portal. So next slide. So from that, the next two slides, I don't expect you to read through them, but this will give you a count from the literature review of those features and organizational elements that were linked to increased likelihood of use. And the point of showing you these two slides, and you can advance to the next one, is really just to show you that there are so many different things for a healthcare organization to consider when they're looking at moving the dial on increasing likelihood of use. Amanda, you can go to the next slide. All right, great. So from this, and advance to the next slide if you would, I just want to highlight a few things. Of the of the features, the highest ranked feature with around 21 of the references citing it was personalized content that helps with disease management. So messages, education, recommendations, and care plan. And the second highest ranked feature was secure messaging. Next slide. Of the design and organizational adoption elements, the highest ranked feature was simple design and use, and ease of registration and login was also significant. Next slide. And of the operational efforts, because it is not all just what's in your portal, you have to look at things like user training and having technical support available for your patients as well. All right, next slide. So at the conclusion of this study, before I show the actual scorecard elements, it really became clear, and I think we could have made a hypothesis about this in the beginning, that there are two key phases of portal adoption: your initial enrollment in and adoption of a portal, and then sustained use over time. So you have to make it easy for folks to be able to log into a portal, and then the things that they want need to be waiting for them there. Okay, next slide. So now real quick, before we go into the example with how things have gone at Emory, I want to show you the components of the scorecard. So over the next few slides, I'll show you the different sections of the scorecard. You'll be able to see that each section works the same. So you've got available points, and then a healthcare organization would either simply enter a 1 or a 0 if they have that particular feature or item, and then those would equate to the points earned. The points earned, you can see, are different for some of the different features, and that was because I used some logic behind the scoring regarding whether things were mentioned a larger amount of time within the literature review, and whether the qualitative interviews also reinforced a feature or an element as being linked to increased likelihood of use. So you can see on this screen, you've got features. So if you were to go through and do your scoring and see that you didn't have personalized education, maybe that would be something to work on. So you can use this to inform your technology roadmap going forward. So you have a features section of the scorecard. Advance the slide, please. Then you have a design section of the scorecard. So this is things like large font, images and illustration, icon-driven, assistive technology, so things regarding vision impairment help, simple and easy to use, as well as a content understanding section. So are you addressing health literacy with things like disease information, medication and side effect explanations? Advance the slide, please. And then the final two sections of the scorecard are technical aspects and assistance, and operational. So technical aspects, is it easy to register and log in? Do you have a single portal for the organization, limited downtime, technical support available? And then the operational side, so not only are you conducting campaigns toward patients to get them to enroll in your portal, but you also have to have the other side of that, the organizational support. So you're involving your providers, your staff, and your clinicians in portal launch and sustainment. So the way that this scorecard works as a healthcare organization, you can see they can get individual scores for each of the sections as well as an overall average. And that overall score, that's all great, but where kind of the rubber meets the road are in those individual scores where they can see at a very granular level those things that they might want to put into their strategy to implement in the future. Okay, please advance the slide. I'm going to hand it back over to my Emory colleagues to go through a case study example of what they've done.
Thank you, Elizabeth. Good afternoon. This is Shannon Caul. For this presentation, we're using a case study that we performed in 2017 and then reperformed in 2020 to gauge the improvements we have made. Emory Healthcare has 3 patient portals that are driven off the particular EHR. Our Blue patient portal is the largest portal that comprises our hospital and faculty physician practices. Our Gold patient portal is for our non-faculty outpatient physician practices. However, we have had several of these transition over to the Blue patient portal within the last 2 years. And our iPortal provides access to the Emory Eye Health records. For the scope of this presentation, however, we'll be focused on the Blue and Gold patient portals. As you can see on this slide, we do have some of the Blue and Gold features of our portals listed. One of the real exciting ones that we implemented this summer was the Fire patient access. So now we're also able to connect to Apple Health, which is a real big achievement for us. And then we also have the basic or standard functions, such as the release of labs within 36 hours, radiology reports within 72 hours, deep heart visit summaries, secure messaging, and prescription renewal. Next slide, please. The next 2 slides focus on our original scores from 2017. And just some noteworthy items on this slide. We didn't score well in the results lab and radiology because we did not have pathology results flowing into the portal. And we also, while we did have a visit summary, we did not have clinical notes on display in the portal as well. Under the design category, we do have some large fonts in some areas, but not in all places. And we did use or involve our patients in design and testing, but not consistently throughout. On the next slide, please. Just to go over some of our other original scores, for test purpose and interpretation, we do have reference ranges listed for our results in the portal, but we do not include a purpose or reason for the interpretation. And then also just to highlight, some providers did include education in some of the visit summaries, but it wasn't consistent throughout. So now that we've done this first initial assessment, what did we do with it? And so one of the first things that we did was we broke out the elements within the assessment based under what was under the span of control of Cerner as our vendor, and then what was under the span of control of Emory to be able to influence and focus. And so on this slide, this just focuses on some of the elements that are more under Cerner's control, such as design elements, browser agnostic, easy to register and log in. One of the things that we did do, even though we categorized these elements under Cerner, we work with Cerner each fall with a planning meeting to understand what improvements they have on their roadmap, and then how can we also partner with them for testing and being able to adopt these features to be able to improve our assessment score. On the next slide, these are our Emory elements. So some of the things that we can do as an organization to improve our score is to implement open notes, pathology results, implement or turn on the health record or the health dictionary functionality. One of the huge wins that we could do is have one single portal, which I think everyone would jump up and down for. And then also do more patient awareness campaigns that are consistently throughout. A lot of times we'll do patient awareness campaigns for a new feature or enhancement, but not consistently throughout to help patients, to remind patients about the benefits of the portal. And then also ensuring our provider involvement is sustained throughout. One of the great things about the timing of when we did this assessment, it was towards the end of our fiscal year in 2017. And so what we did is we used this exercise as a tool to assist in driving our strategic action plan and goals for the next fiscal year, which Dr. Julie Hollberg will explain on the next few slides.
So when we think about patient portal and setting up our strategic plan, we absolutely use the scorecard, and I'll walk you through how we've used that to do some targeted initiatives. But we sat back and at inception of our portal and thought about what are our goals, and really taking a 360-degree holistic view towards the portal. And what I mean by that is that we think about all of the users of our portal. We have found that one of the best predictors for patient experience and patient engagement is the recommendation of the providers and the clinical staff. If a patient goes to a clinic and the physician or the APP talks about how much the patient could benefit from the portal, we found they're much more likely to engage. And so as we target our improvement efforts for patients, we have an area of our goals dedicated to provider and employee experience. We also focus on patient outreach and the patient experience, and then the technical innovation specifically around the features. And then underlying all of this is analytics. So as I mentioned, we're very data-driven, and in order to be able to measure our improvements, it's important for us to have a strong analytic infrastructure. So these are the 4 categories of our goals. And then for each of kind of our categories on the next slide, you'll see that we have initiatives. And these initiatives, you can relate these back directly to the 4 different areas of the scorecard. So we really sort of do a matrix approach between our goals as well as using the scorecard to help improve the portal. So in this fiscal year 20, we're focused on adding pathology results, doing an open notes pilot. All of us today on the phone are huge proponents of open notes and appreciative so much of all of the work that the Open Notes project has done. And unfortunately, amongst my colleagues, there still is a lot of anxiety and reservation, even though patients absolutely have a right to have all of their notes and they can get them easily going through medical records. There still is some trepidation that we're working through to get them onto our portal. We also focus on improving our design, and as Shannon mentioned, we have elements that we can control and elements that we're dependent upon Cerner to control, but we're focusing with our patient family advisors on our material development to, again, continue to improve our patient education and the information, not just for disease management, but also on portal utilization. And then obviously we also are focused on content and operational improvements as well. Next slide. So now what I will walk you through is the scorecard for where we anticipate that we'll be at the end of 2020. We're halfway through our current fiscal year, and the areas highlighted in green are ones where we went from previously having a 0 to now having those features on our portal. So as we mentioned, we'll be doing more on care plans. We'll be piloting to have open notes and more visit details. We'll be working with Kairos to have scheduling integration, and we've gotten much more robust in our partnership with patients and their involvement in design and testing. Next slide. And then obviously on the content, we've made some significant improvements in terms of our terminology dictionary and having more explanations around medications. And then we're also, from an operational standpoint, going to be doing some targeted patient awareness campaigns to help our users become even more engaged on the portal. So if you put that all together, you can see where our scores were in 2017 in comparison to where they were in 2020. And as we alluded to throughout the presentation, organizations run on very tight, healthcare organizations run on very tight margins and have challenges in getting resources for all the variety of really important initiatives. But if you able to get a few resources and focus even on just moving the needle on 4 or 5 of the elements within the scorecard, you can see that you can really make some significant improvements, particularly over time, related to your patient experience in using patient portals. So with that, we hope that you have enjoyed our presentation and have a better understanding of how the scorecard was developed, as well as how we have used that scorecard to develop and inform our strategic plans. And after Rosie's presentation, which we're really looking forward to, we'll be happy to take any questions.